Hello, good day everyone. I am Clerk Lakkian and today we are going to discuss about lumbar puncture. Here is the table of contents of our discussion. First is the introduction, what is lumbar puncture? Second is the indication and its complication. Third, what are the materials needed? And the last is the procedure. So first is, what is lumbar puncture? Lumbar puncture is a procedure that is often performed to obtain information about the cerebrospinal fluids used for diagnostic purposes to rule out potential life-threatening conditions like bacterial meningitis or subarachnoid hemorrhage. It is also sometimes used for therapeutic purposes like the treatment of pseudotumor cerebri. Indications of lumbar puncture. Infectious. Suspected meningitis or encephalitis. This is the most common indication in pediatric. The febrile seizure in infants less than 12 months. Inflammatory like Guillain-Barré syndrome and multiple sclerosis. It is also used for metabolic diseases, for example, non-ketotic hyperglycemia or glycine encephalopathy, and leukemia for diagnostic procedure and therapeutics like in cases of ALL and AML. The contraindication is if the patient is unstable, or if it has a cardiorespiratory compromise, any signs of cerebral herniation, signs of increased ICP, for example, apnea, sluggish pupil, or papilledema, and if there is a focal neurologic signs, previous lumbar surgery, skin infection over the lumbar puncture site, and coagulopathy or receiving anticoagulants. And it's very important to know that if the antimicrobial therapy should not be delayed if LP is contraindicated. So, lumbar puncture is to be done by a neurosurgeon if there is a VP shunt and to consider consulting to anesthesiologist or interventional radiologist if the patient has scoliosis or if the patient is obese and with difficult landmark. So for the equipment, we are going to need the sterile gloves, spinal needle with stylet, skin prep and drapes, collection tubes, gauzes and bandage, and manometer in some cases. It is very important for us to understand needle size before we perform a lumbar puncture. The most common size we use in pediatrics in infants and in children less than 3 years old is gauge 22 or 1.5 inches. In older children more than 3 years old, we use a longer needle with the same gauge 22 with 2.5 inch. In adolescents and bigger sized children, you will use a longer needle at 3.5 inch. The gauge is either 20 or 22, which is wider than 22. Of course, we have to choose between the narrower and wider, and the narrower is better because it will decrease the chance or the risk of CSF leakage. There is a formula suggested how far we could go on lumbar puncture. This will increase your success rate in obtaining CSF. This formula is 0.3 centimeter times height in centimeters. So if you have a 5-year-old boy with a height of 110 centimeter, you can use this formula to understand which needle will you use and how far you can go. So you have to compute the 0.3 centimeter times the height in 110 centimeter. This will give us a result of 3.3 centimeter. So you can use this needle. This is the appropriate size for this child, and you can go as far as this as suggested by this formula. So before we perform the procedure, we have to obtain a consent to parents or the guardian, explaining to them the risks and the possible complication of the procedure. Herniation is extremely rare, but we have to examine the child with complete neurological examination and examination in the eyes for any signs of increased ICP or for focal neurological signs. Using analgesia is very important, especially to the neonates, because it is a very painful procedure. Headache is possible complication of lumbar puncture, so you can use analgesia afterwards. Taking a good history of that the child is not taking any anticoagulants or if there is no history of coagulopathy. Infection, it can be avoided by using sterile equipment, sterile gloves, and performing the procedure through aseptic technique. The subarachnoid epidermal cyst, using a needle with a stylet will decrease this risk. And using a narrower gauge will help you to decrease the risk of CSF leakage. If the parents refuse the procedure, do not delay the antibiotic administration. Using EMLA cream before the procedure is very important, even in neonates. It will decrease the pain while you are inserting the needle, even if you're going to use a local lidocaine or local infiltration anesthesia. EMLA is a lidocaine and prelocaine, and you can use it 30 to 40 minutes before the procedure. The lateral decubitus position is easier and is the preferred position to obtain CSF. It is easier to align the back along the table to be parallel, so this will decrease the chance of unsuccessful procedure, and also it less incidence of post-puncture headache. And this is the procedure where you will be able to measure the opening of pressure. So palpate the iliac crest to the superior iliac crest with your index finger at the same level you have with your thumb, as this will be the space between L3 and L4. You can go down to obtain the CSF between L4 and L5. So use your thumb as a guide and direct the needle stylet exactly in the midline, not above nor below. If it is done incorrectly, it is very likely you will not obtain a CSF. So it should be in the midline exactly and directly slightly above 15 degrees towards the umbilicus. The seating position is another option. The back has to be arched and also perpendicular and not leaning to one side in order to be able to obtain CSF successfully. Locate the site of needle insertion by palpating the superior iliac crest with index finger, at the same time the same level palpating the spinal process. So you are able to palpate between L3 and L4, then go down between L4 and L5 to collect these CSF. After identifying the site of needle insertion, wear sterile gloves and use antiseptic like betadine or chlorhexidine, and clean the skin in a circular manner from inside to outside 2 to 3 times, and then apply the drapes and arrange your tubes in order from 1 to 4. Knowing the anatomy of the spine will increase your success rate in obtaining CSF. When you insert the needle, you penetrate the skin and the subcutaneous fat, then the supraspinous ligament, and then which is the thickest part. Then you will hit the ligamentum flavum, after that the posterior epidural space, then the dura, and finally arachnoid. Then after the arachnoid, you will be in the subarachnoid space. This will be the CSF, or this will be where the CSF will come from. So why it is important to know the anatomy? For example, if you are inserting a needle and your angle is very high, you will hit the bone above, and this will give you a resistance. That's why we need to back up a little, but without exiting the skin, and direct your needle to an angle more or less 15 degrees towards the umbilicus, as this will increase your success in obtaining CSF. And now, it's time to perform the procedure. Before doing it, confirm the back it is parallel to the table. The infant or the child is in a good arch position, arcing like this or in a fetal position, as this will give you a better space between the spine and easier insertion of the needle. Palpate again the superior iliac crest with your index finger at same level parallel to your index finger, using your thumb, palpating the spinal process and using your thumb as a guide to insert the needle 15 degrees towards the umbilicus, and insert the needle exactly in the midline. When you insert the needle, it has to be with the stylet in place, and once you pass the skin, you have an option to remove the stylet slightly and advance it slowly until the CSF comes, and when you obtain the CSF, collect 1 ml in each tube. And then, as advised, 3 to 4 ml are enough for CSF analysis or studies. Then after it is done, insert the stylet and remove the needle, and then apply the bandage. So that would be all for my part. Thank you.